guest today. This is Esther. She's certified Reiki healer. She's gonna tell us a few words about the Reiki technique. So Esther, what you can tell us about this method?
So Reiki, it's a type of healing that arose many centuries ago in Japan, and it's basically a type of technique in which the certified healer or the healer can heal the client with energy from the universe. So this is not me who's doing the healing, but there's a higher energy that is kind of being channeled through me. So basically, I'm just kind of the channel that is helping the client with whatever blockage the person may be experiencing.
So basically, how does it look? How do you do it? This,
So the person will have to be lying and should be comfortable. And usually this will be probably at a specific practice that the healer may have. There's also some instances maybe in which the healer could go to a specific house. Again, as long as the patient can be relaxed in an lying position, the healer will basically place the hands above the body of the client, but you wouldn't be touching the client. It would just basically be, the first scanning will be probably like 5 inches or so away from the body, and of course at the very beginning of the whole session you will prepare the client, you will talk with the client, and you will also tell them that you may be touching certain areas when you actually are doing the healing portion of the session, and that will probably just include the head, maybe the knees, maybe wrist, hands, and the feet. It's also the feet, but other than that, it will just be kind of hovering above the body.
So basically, this technique, what does it do to the patient? Do you open, you work with chakras, or it opens the consciousness, or what does it do?
I would say the short answer to that is it could do different things, and I think you could say that it could include some of the ones that you mentioned, at least in some, not completely, but maybe starting to. So let me explain that a little more. So what the practitioner is trying to do is trying to heal the patient, right? So again, I'm just acting as a channel. So the energy will be given or will be passed through me to the client. So the client will be receiving the healing that they need and for that specific time. So it wouldn't be anything that the client wouldn't be able to cope with per se, but for example, if it's a blockage, emotional blockage, and maybe it sits in the heart chakra, I will be able to transfer, but again, it's not me who's doing it. Again, I have to emphasize that. It's just that energy, it's being passed through me to help the client. So that chakra might be able to open. So that could lead, of course, to some of the things that you're saying, like unblock some of the chakras and potentially also open some of this maybe to the consciousness as well. But I think it also depends on the stage at which the client may be. So if they're really open to this, I think it would just help them to get closer to maybe the attainment of bliss, if you will, or consciousness, or it may just be to unblock a specific chakra.
Okay, so how do you know at what part of the body someone is blocked? Do you feel something, or does the patient feel something?
So the practitioner, for the most part, at the very beginning of the session, again, they will do a so-called scanning. So it's just basically you hover your hands above the body from the crown chakra all the way to the root chakra. Different practitioners will have different sensations, but they could include things like tingling in the hands, they could be changes in temperature, they could be kind of feeling of some sort of energy coming through the palms, in a specific areas when you're hovering. So for example, if you are, let's say, right by the forehead, you may feel heat or cold or one of those sensations. The clients may or may not feel something. It depends.
Okay. Before the interview, you said that you can also do this method in a distance. So how does it work? You just do it over the phone, or?
Yes. So you can also do a healing session through the phone. So long distance. So it could be even in a different country. you have to do, or the client has to do, is again being in a lying position, being relaxed. And there's a specific symbols that the healers use to kind of connect with the energy from the client. And that way you're able to still transfer that healing energy to the client, even if it's long distance. So if we think about energy, we're surrounded by energy. So that can be here in this room, or in a different room, or in a different country as well.
And do you use any equipment to do it, or you just use your hands?
So there's a couple of things. Again, it's not necessary, but for the comfort of the client, it's sometimes nice to have a table in which they can be comfortably lying. Maybe some blankets to keep them warm, and sometimes practitioner will also use a device called a pendulum, just to kind of help you, if you will, kind of with checking if a chakra is blocked or not as well.
Okay. In this group, we talk about anxiety, panic attacks. So, would you recommend this method for people who suffer from anxiety, depression, and all these problems?
Definitely. I would really highly recommend this for people that are suffering from anxiety, depression, panic attacks. For the most part, people after this kind of treatments, they feel very calm. And again, remember that this type of healing is just basically energy being transferred to the patient or to the client that will help them cope with what they're going through, whatever that may be. And they will only receive what is it that they need at that moment in time. Again, different people will experience this a little bit different. Some may feel very emotional after the treatment, but it will be a positive emotional state. Maybe a release will come from that as well. So it could be crying, but maybe in the way of releasing some bad emotions. Right. Or you may not feel anything, and after some weeks or maybe a month, you will realize, or some sort of experience will arise, and you will notice the connection with those two, and it will help the person go through the healing process as well.
Okay, thank you so much, Esther. It was very nice talking to you. I hope this video will help a lot of us. If you have any comment, just please leave it in the comment session. And thank you so much again. And hopefully, maybe we can do it, right? One day.
Yes, for sure.
I will definitely try it. Thank you.
Thank you.
Bye.
Bye.